Hello everybody and welcome back to my channel. In this video I'll be telling you about the industry with the most vacancies in the UK. But first, if you are new here, I would say welcome. I do fashion, lifestyle, travel and car chat videos. Well, according to Statistica, a software that is used to analyze and give predictions, the industry which has the most vacancies in the UK is actually the healthcare industry. What I'll do is that I will post the statistics somewhere here or probably over here. When I talk about the healthcare sector, I'm actually talking about doctors, I'm talking about nurses, I'm talking about healthcare assistants, and I'm talking about care workers. If you were not aware of it, 34% of the doctors who joined the NHS yesterday were from outside of the UK, while between 10 and 53% of nurses were actually trained outside of the UK. When it comes on to residential care workers, the statistic is that 20% of those care workers were actually trained outside of the UK. Now, it says that 20%, I've said 20% were actually trained, of care workers were trained outside of the UK. So that does not include people who were already in the UK from overseas and have decided to do their training within the UK. Now you may ask, why is there such a shortage in the healthcare sector? Well, there are a number of reasons and I'll be telling you about them. For one, the UK, if you were not aware of it, the UK actually has a free healthcare system. So for us, we do not pay for healthcare any at all. When you are sick, you actually, the process is that you actually register with a general practitioner in your area, we call a GP. From that, if there's any healthcare needs, then of course that person is responsible for signposting you. So for example, if there is something to be done at the hospital, the reference will have to, your GP will have to refer you, and then everything is taken from there. Other than that, if there is an emergency, however, you actually can go directly to the hospital on your own, or you can dial 999 and an ambulance will actually pick you up from your destination. So yes, that's one of the reasons, is that we actually have a free healthcare system in place in the UK. Another reason is that Britain can be described as an aging population. So at the moment, Britain is going through a massive age shift with about roughly 11 million people aged 65 and over. And as you are aware, whenever you get, there are some ailments that actually come with age. So because of that, there is more dependency on the healthcare system. And of course, some people are not able to take care of themselves. And under the free healthcare, there is assistance provided for you at home, which is known as home care. For some people with home care, there is an arrangement through the healthcare system, through social workers, everybody come together. And the arrangement is made for someone to visit the elderly within their homes, probably on a weekly basis, probably twice per week, to take care of like their personal care needs or anything that has been agreed. So that's a part of it. Our healthcare system, the healthcare benefits is extensive. So that is why there is a gap. In addition to that, what is provided? Yes, I've said that some people are taken care of in their homes, but in addition to that, There are some people who are not able, they get so weak, so sickly that they require like 24-hour care, or they actually need someone to be present at all times. In that case, we actually have residential homes where instead of someone visiting you in your house, you are taken to one of the residential homes that is privately owned but sponsored through the government, where you are able to access 24-hour care. And as I've said, care workers, residential workers, they are a part of the healthcare sector as well. So you will understand why there is not enough workers to keep up with the demand. Another reason for the gap is because of Brexit. A lot of you would have heard or you are aware of what Brexit means, in that the UK is separating from the rest of the EU countries. Now, with that arrangement, there are some changes in place, in that some people, some EU workers who were actually in the healthcare system have chosen to return to their countries. So you can see why the vacancies are there in the healthcare system. So what does this mean? It means that with this vacancy, with the high, amount of vacancies in the healthcare system, perhaps there will be some changes. One of the changes could be changes in terms of like the visa requirements for people to actually come to the UK to work. I have already seen where I think it is Guyana has actually now, there has been a relax in that they are no longer required to actually have a visa before coming to the UK. So possibly that's one way that the gap will be filled. However, nobody can tell. I would presume that at some stage, perhaps some changes would have to be made. So if you work in that field, perhaps you could consider probably getting yourself prepared, getting yourself ready for the changes. Now, there are some qualifications that can be done online. There are some qualifications that can be, that are recognized. So for example, if in your country City and Guilds is offered, then of course, in preparation for what may come, then of course you can't go wrong if you actually do a City and Guilds course, because that is accepted worldwide. Other than that, the basic care course actually takes like 6 weeks, so you probably could consider that. Or if you find yourself in a situation where you are not qualified, then you probably could consider, going into care as an option for when you actually get into the UK. So yes, that's what I wanted to say in this video, to say yes, the care system, the care sector, the healthcare sector is where the vacancies are in the UK. Now, in my next video, I'm going to ask you to look out for that. I will actually be telling you the benefits of actually studying in the UK. So until I upload another video, I would say if you have not subscribed as yet, do consider. And I actually want to say thank you so much for subscribing to my channel. I can see that when I actually returned probably 2 weeks ago, I was on 179 subscribers, and the last time I checked, I was on 203. Now, I had promised that when I actually get to 200 subscribers, that I would actually do a live. So this coming Friday, I will be arranging a live. Thank you so much for your support, and until I upload another video, bye.